It's Fun Fact Friday. This is Dr. Steve Harris. Today's topic is maintenance for degenerating disc. Degenerating disc is a condition that starts with an injury. In my experience, most of the injuries happen into teenage years, early 20s, or even before teenage years, in that time frame. That's when we're bulletproof, we do too much, we take risks, we're not that good at drivers yet, we have auto accidents, but if you get proper treatment immediately when that injury happens, you can stop it from ever happening. I'm an example of that. I'm 64 years old. I've gone to a chiropractor since I was 6. I was the starting quarterback in high school. I returned the kickoff and the punts. For some reason, people like to hit me. But I'd always get proper treatment after the games, and I've had 3 significant auto accidents before I was 26. And any one of those would have produced degenerating disc in the neck, but I got proper treatment and I have no degeneration of disc anywhere in my spine. So that's how you can prevent it. I always like to talk about preventing problems. But once you have it, on its own, the brain wants to lock that joint up so it doesn't irritate the nerves that are coming through the opening there, because that's how it's operating the body. Well, the only way the disc eats is through motion. So if it's locked up, it's not eating. If it doesn't eat, it dries out. As it dries out, it goes down. As it goes down, it starts irritating the nerve. So it's kind of kicking the can down the road, and then after a while, catch up with the can. But the way you can maintain that, first of all, proper treatment is to get spinal reconditioning in this office, chiropractic treatment, disc decompression, and laser. That's the gold standard. We can take those degenerating discs, renourish it, remoisturize it, back it up a few years, give you up to 17% space back, and in some cases the discs that should be like this but that are bulged or herniated, we've seen it go back 100% before and after MRIs. So the way you maintain it, even after you're done with treatment here, this is the main reason I'm talking to you today about it, is it needs maintenance. It's a permanent condition. On its own, without treatment, it's going to degenerate. It's just a matter of time where that gives you trouble. And that can become a health problem, a major cause of health problems, because of pressure on a nerve. That nerve goes to some organ. That organ is not going to work right if it's got pressure on it, that nerve. So the way you maintain it, even after you've done the complete treatment, is come in once a month. Get chiropractic treatment once a month. And we're in pioneering territory on decompression and laser, but I've learned from my patients. I've had patients play with this all over the place. I have one lady that's been in and received 101 decompressions. I can't keep her out of here. But it's working for her, but that's not cost effective. The cost-effective maintenance is once a month chiropractic treatment to keep that that joint unlocked, and every other month do a spinal disc decompression, the traction, the renourishment, the pulling the disc in, and laser. So once a month come in, every other one of those months will include decompression and laser. That's how you maintain the disc. You have a degenerating disc, you have to do things that are friendly for your back. Overreaching, overlifting, lifting far out from your body instead of close to your body, those are no-nos for people with degenerating disc. So there's a little information about degenerating disc that I hope will benefit you. Thank you for watching.